Hi guys, this is Charles. I'm one of the surgeons at the Animal Emergency Center in Moorabbin. So we have an unfortunate case of a 11-year-old Staffordshire Terrier cross that has this huge ulcerated mass in the left flank, and it's a squamous cell carcinoma previously removed. It's recurred. We've got really bad pyoderma as well. The dog is on pred for skin disease. We've got another little squame that's sticking out over here. And we found another cancer near the ear, found another big cancer near the axilla, we found another cancer in the lung, and so basically the option was either, like we could have gone after all of the different tumors, but the likelihood is that the mass in the lung is actually a secondary from the mass near the ear because they looked the same on CT. And so the other option would have been, euthanasia, because this issue, this mass in the inguinal region is bleeding and really causing a lot of problems. And so the owners have elected to go ahead and treat it palliatively. And so that's what we're going to do. So we're doing a kind of a marginal excision of the mass. The nice thing is that it's in the flank, and so basically because we use this area for a flap, the flank fold flap, that means that we've got lots of extra skin here. So I'm hoping we'll be able to close this primarily. Let's just see here, worst case scenario. We could probably borrow some skin from the front of the knee. I'm reluctant to do a lot of reconstructive stuff just because our margins are likely not going to be clean, and so I'm concerned about contaminating a big donor field. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So, yeah. She's supposed to call at 4 o'clock. We can call her. Cautery is quite... Can we get that turned down to maybe... If it's on 30, let's turn it down to 20. Lights are actually a bit bright. I don't know if I can get around that to turn that down. Very sweet old dog, sadly with a lot of problems. One of which is that she likes to sunbake on her back, and that's what probably caused her to get these, at least these squamous cell carcinomas in the first place. And we're hitting all these vessels that supply the flank fold flap that make it such a robust flap. Just try to move that out of the way. These abdominal skin squamous cell carcinomas can be a real pain because you can get a wide margin on what you can see, but all of that skin has been exposed to the same amount of sun. And so often you'll get recurrences, and whether they're actually recurrences or what are called skip lesions, which means that you just have multiple foci of the same cancer in a region.
Do you need more color cream or?
All good. So that's deep circumflex iliac vessel, ventral branch. I don't need that. Thank you. Just try to get the lighting a little better here. Okay. And I'm probably not getting quite as wide a margin as I would if we were doing curative intent surgery. This really is just palliative. There's deep circumflex, there's a caudal superficial epigastric vessel right in here. Probably. So there's a question, why not curative? The reason is that this dog has multiple cancers throughout its body. So it has a mass in the ear that's been diagnosed as a sarcoma. It has another mass in the lung, which looks the same on the CT scan, which I'm concerned is also a sarcoma. It has a mass in its axilla, which is also probably a sarcoma based on its appearance on the CT scan. Okay, so that's the mass removed there with the ulceration. Can I get some bupivacaine, please? How much does this dog weigh? 32. So I need 12 mils or 10 mils, I guess, is in a bottle. All right, so that's basically my flank fold flap right there. That's where we would take the flank fold flap from. So now what I need to do is figure out what direction I'm going to close it in so it's under the least amount of tension. Just getting our bupivacaine now. I'll try not to stick Tiana with my needle. She might get annoyed with me. Just do a splash blob. Can I get some OPDS, please?
You might need another one.
So I'm just injecting bupivacaine along the skin edge. And there's no reason, I know I'm going to get asked this, whether I would put a drain in here, and there's no reason to drain this. I'm just going to close dead space, and that is much more effective and less likely to get infected.
You might want to save some facility.
Yeah. Okay. All right, so just have to figure out what we're going to do here, what angle is going to be easiest to close this.
You need some towel cream?
Do you need me to release tension using it?
Yeah, that's probably good. So by folding the leg out back down, it's releasing or relieving the tension I have. All right, so we'll pull that back up a little bit. So I'll just close my sub-Q first. Maybe not quite so close on the suture. She's not intact, is she? She's been spayed. Her mammary tissue, I guess, looks like she's been spayed, but just there's some thickening down here. Yeah. And if it had just been the axillary mass and the ear mass and this mass, but not the lung mass, I probably would have been happy to go ahead and take all of them. But in a dog of her age, the owners are reluctant to remove, to do a thoracotomy, especially since there's a reasonable chance that it's a secondary from the ear mass. The other thing I offered that they could do would be to get an ultrasonographer to aspirate the lung mass to see if it looks like it was the same thing, but they said basically that regardless of what it is, they probably wouldn't put her through a thoracotomy. So that's why we've elected to do just the palliative procedure. I'm just going to do another layer, superficial sub-Q layer.
Do you have another one here?
The more layers we can close, the less tension is going to be taken on by the skin. That is pretty snug. Let's just bring that down like that. Thank you. All right, so let's see what we've got here now. So that skin, I think, is actually going to come together, especially once it's down like this. So the only palliative care she'll get, she's going to be put on antibiotics for her pyoderma, and then just pain relief if she develops any more tumors. so I'm going to leave Cindy to take over from here and finish up the intradermals. And I'm going to go and make sure that there aren't any questions that I haven't answered. The other thing to do probably would be some big cruciate sutures in the skin as well when you're finished, okay? All right, so the mass, look, I don't know that we need to send it off because we know that it's a recurrent squamous cell carcinoma and we weren't going for margins, so we probably don't need to. We'll check with the owners and see what they want to do. That's a good question. And I think that's pretty much it. So I'm going to go ahead and terminate the live stream. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And if you know anybody else who'd be interested in watching live surgery videos, if you could share the channel with them. Thanks a lot, and we'll see you again soon.